Hey, good morning. Welcome to our live hangout today. Today we're going to talk about how to stop excessive sweating with Dr. Jeffrey Rapaport. My name is Craig Ewer and I'll be your host today as normal. Now, in today's hangout, you're going to learn everything you wanted to know about your sweat glands, excessive sweating, and hyperhidrosis, which is the clinical term for excessive sweating. So, if you suffer from excessive sweating or you just want to sweat less, then stick around and learn this fast solution. Good morning, Dr. Rapaport.
Good morning, and it's good to see you again, Craig.
Yeah, well, great to have you, and I certainly appreciate your time. I'm sure the viewers do as well. So, you said have a look at, we're going to be talking about excessive sweating, the subject of sweat. You know, everybody does sweat. What is hyperhidrosis? I know there's different levels of sweating, and we'll certainly get into details, but what is the clinical term, hyperhidrosis? You know, there's probably a couple of questions. How many people are affected by this clinically? Because I guess there's a clinical crowd of people that are affected by this. And then there's people that probably just have excessive sweating. How do you break down the clinical group and the regular group of people who just have excessive sweating?
Well, you have a whole bunch of questions in there, but let me start off with number one by saying that there's 4 million people in the U.S., about 1.2% of the population, that have what we call hyperhidrosis. Now, hyperhidrosis can be, usually means that the sweating that people have is intolerable, and it affects their daily activities. Almost everybody is going to sweat normally if they're under emotional stress, or if they're in a warm situation, or if they eat certain foods. However, there's a very small portion of people, about 1.2% or 4 million people, that have excessive sweating, where it's intolerable to them, it's emotionally distressing, they cannot go about their normal activities, and these are the people that usually come in for treatment of hyperhidrosis. Having said that, there are some people also that would rather not sweat at all, and that's not even in that percentage, there's some people that for whatever their occupation or for whatever they believe is socially acceptable, they don't want to sweat at all. And there are some people that can come in and get treatment for that, but I really wouldn't call that true hyperhidrosis. That is really that they just don't want to have sweating. Now, remember, sweating is part of a normal thermoregulation that the body, nature is very smart, and the body has set up thermoregulation mechanisms. There's sweating on the palms, there's sweating on the soles, and there's sweating underneath the arms. When the sweating becomes more than the body needs to cool itself, which is the purpose of sweating, then we call it hyperhidrosis.
Right. So what I'm understanding here is that you have this group of people who I would expect, if they have such a problem with this sweating issue, that they will probably know that they clinically have the problem of hyperhidrosis. And therefore there are solutions to that problem, and therefore they should search out you to have this problem solved, as you're going to learn today. But then there's this other group that just probably sweat excessively, who could have the treatment. How do you know? I mean, I sweat and stuff at the gym and so forth, but I don't necessarily excessively sweat myself. How do you is it something that, I mean, you can't do a litmus test. I mean, the clinical group probably know, but what about the other crowd that maybe are on the borderline? That's what I'm trying to maybe establish.
The rating scale that we have has to do with, number one, whether it's tolerable or intolerable, and number two, whether it affects your daily activity.
Right.
And the group of people that find it to be intolerable and affecting their daily activities are considered to have hyperhidrosis.
Got it. Right. Excellent. Good. All right. Okay. So those people who are excessively sweating as well, then obviously they can make the phone call as well and have some treatment. Now, I've been looking into all the different treatments out there like I normally do. And in my research and my knowledge of the industry, I mean, I look at the magazines, I look at all the trade shows, all the different machines and different methods that there are to all these different types of treatments in the aesthetic world. But hyperhidrosis, the reduction or the getting rid of excessive sweating, under my research, and please help our listeners here, I've come across you can treat it topically. I've seen adverts for Botox, injecting even Botox to get rid of sweat, which I never thought. I mean, I thought that was for the face, but obviously now doing Botox for getting rid of sweat. And then I've seen other laser machines, which I can't exactly recall. And then I've seen a product called Mirror Dry, and then you have a treatment called Mirror Dry, should I say? And then there's I think some other machines even, and then there's Precision TX, which I believe is the type of treatment that you do. Can you just explain the differences of why you would maybe use one of these types of treatments over another, or whether what works, what doesn't work in your experience? How does the consumer make a decision which technology to use to get rid of excessive sweating?
Okay. All of the things that you mentioned work to some degree. So let's start. The person that comes in with sweating that isn't intolerable and it isn't affecting their daily activity, the first thing that we would do is prescribe a strong aluminum deodorant or aluminum solution. There are a whole bunch of them. The most common one is one called Drysol. Dermatologists routinely, when someone comes in and says that they're sweating excessively under the arm, will tell them to use the aluminum salt, which is Drysol, and tell them to use it in the morning, because surprisingly, Craig, people with hyperhidrosis don't sweat at night when they're sleeping. Believe it or not, they'd only sweat when they're awake.
Oh, lovely.
So, well, I found that to be a fascinating finding. So what we would do for someone who's just has minimal amount of sweating, we would tell them to use the aluminum salts. First, they can try an over-the-counter one. If that doesn't work, they can go to the dermatologist and get something called Drysol, which is stronger, and you put it on in the morning when you wake up, and it does help decrease the sweating. There are side effects in that it's irritating, and right on the container it says may cause breast cancer. So there are some potential significant side effects to using these things on a long-term basis. The second thing which you didn't mention is there are some what they call anticholinergic medication, something called glycopyrrate, which are pills that you can take by mouth. They shut down the sweating that you have in all different locations. People who are in the theater sometimes will use glycopyrate, but it has side effects. It can, in addition to the sweating, it can make you feel very hot. It has a great deal of side effects because it's a systemic pill.
Right.
Then the next thing that I would talk about is Botox. Now, Botox we've been using, and I think Botox is a pretty good treatment for hyperhidrosis. It also works for sweating on the forehead if people come in. We do that in addition to the underarms. The downside with Botox is twofold. Number one is that it lasts only on the long side 6 months. The average is 4 to 6 months. The second thing is that it's expensive because Botox, if you get 100 units, costs $520 without the injection fee. That's just the cost of the material. And number three, most of the insurance companies were paying for hyperhidrosis treatments. And now we're starting to see that they're not covering the hyperhidrosis Botox for treatment of the axilla. More and more insurance companies are not covering this. And people get tired of coming once every 6 months and getting their axilla injected. It's even if it's covered by insurance, you know, it becomes somewhat burdensome, and it's not really a pleasant experience. So Botox is probably the #1 thing that people are doing for hyperhidrosis right now. In addition, there's another company called Miradry, which developed a microwave treatment. The whole key here is to shut down the sweat gland, which is also known as the eccrine gland. And the microwave treatment, just as the Precision TX, attempts to decrease the eccrine glands in the axilla and to get them to shut down. Not to decrease the number, but to destroy them. The problem with the Miradry is that the redo rate, meaning if you have a Miradry and you have one treatment, 87% of people are going to need a second or third treatment.
Okay.
I don't find that those numbers to be too great. Miradry tends also to be a little bit about the same price as the other treatments, but it tends to be a little bit more expensive in that the company charges every time that you use one of their treatments. In other words, there's a usage fee. But the patients don't really need to worry about that. But what they should be concerned about is that it is not as effective as a 1440 laser, which the Precision TX uses at treating eccrine glands. And for that reason, the redo rate is about 87% need a second or third treatment, whereas it's about 1 in 3 for the Precision TX.
Well, that was one of my questions in terms of success rate, because I know Botox, as you've just explained, you need to have regular in effect to keep compliant. You've got to have regular treatments throughout the year to maintain it, which gets expensive. The Miradry, you're saying like 80+% of people have to come and have the treatment redone. Sounds like the Precision TX, about a third of people then maybe have to come back and have a further treatment.
Yeah, those numbers are correct.
Right. Okay, so yeah, you answered I'm just looking down my questions here in terms of the success rate. My other question was how many procedures, which was probably part of the success rate. Is it just with the Precision TX? Is it just one procedure? You come for how long, and what is the procedure? Just explain the procedure process.
The procedure lasts about an hour. The patient comes in, and there are some tiny holes that are made in the armpits, and then numbing fluid is put into that area. And then through those tiny holes, a laser is put underneath the skin. And the beauty of this laser is that the laser can be directed. Most lasers, the energy comes out in all different directions. In this laser, which is very similar to the laser that we use for cellulite, you can direct the direction of the energy. So we can direct the energy all the way straight up towards where the eccrine glands are, and that's why it becomes more effective, because number one, the 1440 wavelength is extremely effective with absorption of water, and water is what mainly the eccrine glands are made of. And number two, we can aim it straight at the eccrine glands so that we can get a better result, and we're not scattering the energy all around and just trying to get as a secondary effect the eccrine glands.
Right. So this is what you would consider non-invasive in terms of there's no going under anything or cutting anything.
No, I wouldn't call it non-invasive. I would call it minimally invasive, because the laser fiber has to go underneath the skin. There's no question about that. I mean, lately we're using a lot of cannulas and things under the skin when we're doing facial reconstruction. So I tend to minimize it more than I should, but I want to tell my listeners that I wouldn't call it non-invasive, I would call it minimally invasive, because anytime anything is put underneath the skin, it's still minimally invasive, and there are potential things that can happen with things when things are put underneath the skin. but it's a local anesthetic. Nobody is put out, and people are comfortable when they do the procedure. There are a few side effects afterwards. Everybody, a large percentage of people for 2 or 3 days will have some numbness. They may have some slight discomfort. They may have some swelling. That's all pretty much common. But it usually lasts about 2 or 3 days.
So it doesn't hurt any more than having like laser hair removal or something?
No. It's just a more complicated situation because with laser hair removal, number one, everything is done from the outside, and the numbing is usually topical for you. Here, we have to put the numbing underneath the skin.
Right.
So
I was just trying to make reference to
the numbing and the laser cannula.
Yeah, I was just trying to make reference to a lot of people have had laser hair removal and can have an idea of how painful that is in comparison with other things, but. Okay, so it's not very painful, doesn't last long, it's effective, it's fast. What about how long is it until people see the results? I mean, do you have the treatment and then you leave and all of a sudden you're not sweaty anymore?
No, it takes about, see what happens is we have to destroy the sweat glands and it takes a little while to work. So usually it takes about 3 to 4 weeks until you start seeing it. I have some slides and some photographs to give you an idea of, and let me try to explain to you. There is a test called,
Do you want me to show the slides as you're talking?
Not quite yet. I want to explain to our listeners something. The way that we quantify and localize sweating is the following. We know that if you put iodine on the skin and then you put cornstarch, this is called the miner's starch test, what will happen if people start sweating is that it will turn purple or blue where you have the iodine when it mixes with the sweat and the starch. So what happens is when you come in for a treatment, the first thing that we'll do is put on some iodine and some starch, and we'll want to look at the areas where you have the most sweat. Some areas underneath the axilla may be sweating a lot, and some may not be. You want to know exactly what area is sweating, and you want to mark that out so that when you do the treatment, you concentrate on those areas. We also use the same iodine plus starch to follow the treatment to see whether or not the patient is actually improving.
Okay.
So we look at the first visit with the starch and the iodine and see the color changes, and then we look and we follow it out for a couple of different months, and then we see if there's improvement or exactly how much improvement. In some cases, there may not be any sweat returning. In some cases, it may be 80% or whatever, and it's easy for us to follow. The pictures that you have show the before with the sweating, and they show that after months pass, that the areas no longer turn color from the combination of the iodine and the starch.
I'm looking at the pictures right now. Do you want me to show?
Yeah, show the picture.
Okay, let me just pull up these pictures. Just have to technically get to the pictures, which I think everybody should be seeing right now. Can you see the pictures?
Yes, I can. Okay, so
all right.
Here on the left side, okay, here is the baseline. You see that purple color? That means that there's a lot of sweat that's combining with the starch and the iodine and giving you that purple color. The next picture is you look at 3 months later, and you can see that it is not as much purple color, and the amount of area is also decreasing. Let's go to 6. Let's go to 6 months. First of all, on the 3-month picture, the key is the purple color is minimal. There's brown, but there's not much purple, and we estimated this at a 97% reduction. On 6 months, we'll see a 98% reduction. You don't see much purple color at all or brown.
No.
And then again, I think this should be 9 months or a year. You will see that there's a 100% reduction in the amount of sweating. And I think this is one side. I think you have the other side also.
Yes, I have the right.
Okay. And here's the other side. You can see what happens is on the before pictures, there's brown. And then as we get along, there's less and less brown and purple. And it gets to be less, and 6 months is 100% reduction, and you can notice that as we progress, the amount of sweating is markedly. And this is what we would do with the patient. This is how we follow them. Because if someone comes in and says, I'm still sweating, we want to see how much are they still sweating compared to what they were when they came in.
Do you actually take pictures like this?
Yes.
Yourself?
Yes.
Oh, excellent. Yeah, because these are impressive to look at, and that test that you explained, and to be able to visually see it, it's impressive.
Patients are happy with this procedure.
What percentage happy rate would you say that you have for this particular precision TX treatment? How long have you been doing it in the practice?
I'm doing it for almost a year. I was involved with the company Cynosure when we were developing the protocol for, I think, a year and a half ago. And the patients that are not in the initial third, in other words, the initial 2/3 that get the results with one treatment are extremely happy. The ones that come back after 6 months and have to be retreated are less happy, but once we do the retreatment, then they become happy. Of the people that we've done, most of them are happy. I would say about 80%, 80 to 90%. Nothing is 100%. Any doctor that tells you that their patients are 100% happy or that any treatment is guaranteed, I always mention this on our hangouts. Don't believe it because it's never 100%, but I would say the satisfaction rate is high, somewhere between 85 and 90%.
Okay. Well, that's high with any of the cosmetic procedures, definitely. Now, I just was looking at the questions. I have this question here is, obviously the armpit's the obvious one. What about, are there any other areas that you do treat? I mean, we do sweat in many other areas on our body, but is it just for the armpits, or is it for any other areas? And how, unlike Botox, so there's two questions, any other areas, and unlike Botox and other treatments that you have to regularly keep being compliant and having top-ups, how long does this treatment last? Is it forever? Or
well, the treatment's been around for a year and a half, so I can't say or that it lasts forever, but it should last for a significantly long time, number one.
Okay.
Number two, Botox can be put into the palms and into the soles. It's significantly painful, and for that reason, we don't do it in our office, but that can be done. And Botox can also be done into the forehead for people that sweat a lot. There is something called iontophoresis, which is an electrical treatment for people that have palms and soles that can be bought, believe it or not, over the counter. And they keep their hands in a special salt water solution, and they do it a couple times a day, and it basically clogs up and shuts down the sweat glands. But in terms of using the precision TX to treat, the only area that we really can do is the axilla. There are just too many nerves in the palms and soles, and there are too many tendons and muscles to navigate around. So we really stick with the axilla in terms of treatment of the hyperhidrosis.
And when you refer to axilla, that's the armpits, is it?
Yep.
Right.
That's the armpits.
All right. Okay. Now, I just want to go back to something you mentioned earlier with reference to insurance, because I know I work with a lot of doctors all over the world, and different areas of the world this is covered under insurance and not. Some procedures for hyperhidrosis have been covered under insurance in the US. I know insurance changes in the US. You made reference earlier to Botox and insurance. Please just elaborate on the insurance, whether the Precision TX is available on any insurance policies, or it's just a blanket, it's now an elected treatment, cash type of treatment. If you could just elaborate on the insurance for this.
Unlike Botox, the Precision TX is not covered by any of the insurance plans. They have thought in their infinite wisdom that it does not need to be covered because it's not entirely medically necessary. And as I said, a lot of the companies now are not covering Botox also. I think you're going to find that a lot of these treatments that are more for patients' emotional and psychosocial well-being are going to be eliminated from the list of things that insurance companies cover. So let me just re-mention that, number one, it is not covered like Botox is usually covered, and I don't think it will ever be covered. But in the long run, it is a lot simpler, a lot more effective, and a lot more long-lasting. So I think there's some value to the patient to pay out of pocket to have this done.
Okay, excellent. I know certainly if I had really excessive sweating, I'd definitely be having any cosmetic treatment that helps with any of these cosmetic problems. Now, just that segues nicely into, if everybody has obviously hyperhidrosis and clinically diagnosed, or just has excessive sweating and wants to get rid of it because it's either a social problem or corporate problem in the corporate world, or just in social settings, it's interfering with their life. How much is this going to cost? I know there's various different, like Botoxes and things like that. You've got to keep compliant and going back every so often throughout the year as a one-off treatment in comparison to mirror dry or any of these other one-off style treatments. How much would the Precision TX cost in your practice typically?
In my practice, and my costs tend to be actually on the low side. It runs somewhere between $2,500 to $3,000 for the Precision TX. If the patient needs a second treatment, we add a nominal cost for the second treatment to cover our overhead, but that's the way we take care of it.
Mm-hmm. Okay. So, how would somebody maybe come in? How would you determine if somebody needed some additional sort of treatment? Is that just from a consultation?
The best way to see if they need a second treatment is to see if they're happy. If it's intolerable, we'll go and do it again, and we'll do the starch iodine test. But it's usually only 1 out of 3 patients. If we do 15, it's about 3 out of the 15 that will come back and want a second treatment. And this is, when you're talking about cosmetic things like this, the decision is actually made by the patient. If the patient doesn't, if the patient thinks that they need to do it, then that's it.
All right. So, if somebody was listening to this this hangout and saying, right, I'm a candidate, I want to go and see Dr. Rapaport, I want to go to his practice and have a meeting and see if I'm a good candidate, what would the next procedure be?
Well, the next procedure would be to give us a ring at the telephone number of 201-227-1555, which is my Englewood Cliffs office, or they can see us in our Old Bridge office also, or check on www.cosmeticskin.com and set up a consultation, which we do not charge for. It's complimentary.
Okay.
And let's see if you're a good candidate or not. To be honest with you, most people know themselves if they're a good candidate. And the line is, if it's psychosocial or emotionally upheaving, and the patients have trouble with living their daily lives and they find it intolerable, then they're good candidates. So it's not one of these type of things where we have to do an extensive evaluation. It's more of a history. And once your listeners have heard what what our criteria are, they will know whether or not they're candidates, because they will know it's intolerable for them to go through the day. They will know that the sweating is so bad that in social situations that they have trouble existing. So they know that they need to have something done. And a lot of these patients will have been treated by Botox and may have been saying, well, my insurance company's not covering the Botox anymore, or that I don't want to be coming every 6 months to get, or 4 to 6 months to get the Botox. I don't really want to deal with that. Let's do something that's more permanent in nature.
Yeah, I've heard of people that are having to change their clothes maybe 2 or 3 times a day, or putting on many layers of clothing just to try and mask or hide the problem. So
well,
yes,
I have one lady who I don't want to mention, she's also a friend, who only wears black clothing because the sweating is so bad that she only wears black clothing.
Right. So I agree. Those people they will know who they are, and what I like about these hangouts, Dr. Rapaport, is the fact that it is so confusing out there. You look at the magazines, you watch the television, you read different solutions out there as to what's available for cosmetic treatments, and it's just confusing. As we said earlier, there's the pills, there's the Botox, there's the topicals, there's mirror dry, there's all these different methods. And I thank you for sharing in terms of what technologies there are available today that doctors like yourself and your peers use, and that the consumer has choices. So the consumer's more educated, and that's the purpose of doing these hangouts. So the consumer who has a problem and is looking for a solution is educated in terms of what's available to them and what's current and now, and that's going to get the best results for them for the outlay of the cash for a cosmetic treatment, which are never cheap. So I certainly appreciate you educating us today on all the.
I have a lot of people that come in, lots and lots of people that come in and say they've watched these chats mainly on YouTube, and that they've gotten an immense amount of information, and that they, just like you said, they had no idea about how to sort out all the things that are out there and what to believe. And once they find out from our discussions that we're separating the wheat from the chaff, and we giving them honest answers and where they should look, etc., they find it very, very helpful. And I have to tell you that the patients and the people that come in for consultations they feel empowered because they have the knowledge, and knowledge is what they want.
That's it. So we all know that we're spending our money wisely. That's the whole point, that we're not spending it and have to redo it or do it 3 times, or you know how it goes in this industry. There's just so many different solutions. But I think, do you have anything else to add? Is there anything else you want to?
I think we've covered everything. I appreciate people listening, and I'm glad I can help them with a situation that is very emotionally distressing and a big psychosocial problem for a lot of people. And it's always good to spend a little time with you.
Yes, well, thank you. I appreciate that, and thank you for your time educating us today. For all the listeners, as Dr. Rapaport says, cosmetic skin. It's down here on you can see the website that's listed on the screen right now. So I suggest go to Cosmetic Skin, have a look around. We're going to put up a few other additional videos with these before and afters, and some other videos of the treatment, so you can see some more information. And I suggest pick up the phone and get a free consultation, and go and see Dr. Rapaport. Otherwise, thank you, everybody, and thank you, Dr. Rapaport. We'll see you next time.
Take care, Craig.
Thank you.